It's normal to feel anxious from time to time, especially if your life is stressful. However, excessive, ongoing anxiety and worry that are difficult to control and interfere with day-to-day activities may be a sign of generalized anxiety disorder. If you have GAD, you may also have another mental health condition, such as depression. It's possible to develop generalized anxiety disorder as a child or an adult. Generalized anxiety disorder has symptoms that are similar to panic disorder, obsessive-compulsive disorder, and other types of anxiety, but they're all different conditions. Living with generalized anxiety disorder can be a long-term challenge. In many cases, it occurs along with other anxiety or mood disorders. In most cases, generalized anxiety disorder improves with psychotherapy or medications. Making lifestyle changes, learning coping skills, and using relaxation techniques also can help. Frequently asked questions. What are the symptoms of generalized anxiety disorder? People with GAD may feel restless, tense, or on edge. They may find it hard to focus and have recurring thoughts about a source of worry, such as finances. Physical signs include gastrointestinal disturbances, muscle tension, twitching, trembling, and sweating. They may also have problems sleeping. GAD can also interfere with daily activities, including work or studies. What is the main cause of GAD? Doctors do not know why GAD happens, but it may be linked trusted source to levels of serotonin and norepinephrine in the brain. Often, people feel better when they use drugs known as selective serotonin reuptake inhibitors, SSRIs, or selective norepinephrine reuptake inhibitors, SNRIs, which help maintain circulating levels of these hormones. What does GAD feel like? If you have GAD, you may feel as if your problems or your anxiety are out of control. Daily life may feel like one long round of worry, fear, and dread. You may also notice physical symptoms, such as clenched muscles, sweating, trembling, or twitching. The anxiety may last for months or years. Sometimes it's present from childhood, but it commonly begins around the age of 30. Treatments. Treatment options for GAD depend on the severity of a person's symptoms and the presence of any other conditions. Many people require a combination of treatments, such as attending psychotherapy and making lifestyle changes. Medications may also be necessary. Treatment options include psychotherapy. Working with a therapist can help people effectively manage their symptoms. Doctors and mental health professionals would often recommend cognitive behavioral therapy, CBT, for anxiety, as it is both safe and effective. Studies suggest trusted source that CBT reduces worry in people with GAD, with the effects being equal to those of medications and more effective 6 months after treatment completion. Other types of therapy that show promise in treating GAD include mindfulness-based therapies and acceptance and commitment therapy. This is a type of therapy that uses both acceptable and mindfulness techniques. Medication. In some cases, a healthcare professional may recommend medication to help with the symptoms of GAD. Several types of medication can treat GAD, including antidepressants. Most commonly, doctors will prescribe selective serotonin reuptake inhibitors or serotonin and norepinephrine reuptake inhibitors for GAD. These drugs can take several weeks to work. Buspirone. This is an anti-anxiety medication that reduces the physical symptoms of anxiety. Buspirone can take several weeks to take effect. Benzodiazepines. Occasionally, doctors may prescribe a benzodiazepine for short-term anxiety relief. These medications are fast-acting, but they are highly addictive and may not be suitable for people with a history of addiction. Summary: people with GAD worry more intensely and frequently than other people. They may worry about one thing for a long time, and sometimes they cannot identify the source of the anxiety. Stress, physical illness, and life changes can worsen symptoms. Treatment is available in the form of medication, counseling, and lifestyle remedies. Anyone who believes they may have GAD should seek medical advice. Treating GAD early may help prevent complications, such as depression and social isolation.
Thanks for watching. Please like, share, and subscribe.